affected so many, and so we dedicate each October to raise awareness about this disease. According to the World Health Organization, breast cancer is the most common cancer among women. Did you know that it affects 1 in 8 women during their lives? Although rare, men get breast cancer too. This year, an estimated number of 2,620 men will be diagnosed with breast cancer in the US, according to the WHO.
Cancer is a broad term for a class of diseases characterized by the abnormal growth of cells that divide uncontrollably and invade normal body tissues. So breast cancer starts within the cells of a breast as a group of abnormal cells and then can infiltrate the surrounding tissues or even spread to other areas of the body. The signs and symptoms of breast cancer include a lump in the breast, bloody discharge from the nipples, a change in the shape or texture of the breast or nipples, a pain in the breast that doesn't go away even after your period, and many more. Nonetheless, these signs and symptoms should be discussed with or reported to a doctor before assuming it's breast cancer, because they can be caused by other medical conditions that are not breast cancer.
Screening is used to detect breast cancer before it develops any signs or symptoms. Screening methods include mammography, self-examination, and the use of an ultrasound or magnetic resonance imaging.
Mammography is the best tool doctors have to screen a healthy woman for breast cancer, as it has been shown to reduce death from the disease. Like any other medical test, mammography involves risks such as the possibility of additional testing and anxiety if the test falsely shows a suspicious finding, known as a false positive result. Also, up to 10% to 15% of the time, mammography does not show an existing cancer, and this is known as a false negative result.
Regularly examining your own breast could be a vital way of detecting breast cancer at the early stages. It is very important for women or young women to be familiar with their own breast so as to detect any change that might come up and report them to their doctors.
Doctors seldom know why one woman develops breast cancer and the other doesn't. Most women with breast cancer can't pinpoint the exact cause of it. The risk factor is anything that increases the chances of developing breast cancer and can be one that influences its development and not necessarily be the cause of it. The risk factor for breast cancer increases as a woman ages, and with most of its cases occurring in women older than 50. A woman with breast cancer in one breast has increased chances of developing cancer in the other.
A person with a family history of cancer is at a higher risk of developing breast cancer. However, it is reported that inherited breast cancers are less common, making up 5% to 10% of cancers. Women who began menstruating before ages 11 or 12 or went through menopause after age 55 have a somewhat higher risk of developing breast cancer. Also, women who had their first pregnancy after age 35 or have never had a full-term pregnancy are also at a higher risk of developing breast cancer.
Other risk factors for breast cancer include using hormone replacement therapy after menopause, being overweight, lower amount of physical activity, alcohol drinking, smoking, and exposure to ionizing radiation. It is important to note that some people with several risk factors never develop cancer, while others with no known risk factors do. Nevertheless, knowing your risk factors and talking about them with your doctor may help you make more informed lifestyle and healthcare choices.
Well, there was a theory, which was that when a lady wears her bra, especially the one with the underwire style, it tends to restrict the flow of lymph fluids out of the breast. When there is that restriction, it tends to accumulate other substances in the body. This makes sense, but then there's no foolproof evidence that shows that that's actually the cause of the cancer that's wearing the bra. So then the fact is that breast cancer is not caused by wearing a bra. There was a research that was conducted in University of California in Berkeley, where they discovered that the compression of breast cancer cells causes it to assume a normal shape after a long period of time. So breast squeezing that. Well, even though this also makes sense, they play down on the fact that there is no particular evidence or practical use of that information that they found. Hence, there's no full fact that breast squeezing can cause breast cancer.
Treatment of breast cancer depends on the stage of the cancer. It consists of chemotherapy, radiation therapy, and surgery. The average 5-year survival rate for women with non-metastatic invasive breast cancer is 91%, and the average 10-year survival rate for women with invasive breast cancer is 84%. If the invasive cancer is located only in the breast, the 5-year survival rate for women with breast cancer is 99%.
There is hope for anyone who gets diagnosed with breast cancer, as there are over 3.5 million breast cancer survivors in the United States.
To anyone out there battling with breast cancer, always remember that your present situation is not your final destination.
I have no doubt that you will fight breast cancer with the same ferocious determination with which you face other challenges in your life.
I know that the great strength you have will prevail.
May God give you strength and courage to continue your valiant fight until you are well again.
Always remember that hope is a bridge that connects cancer with recovery.
Breast cancer is not a life sentence.
Never give up the fight. There is still life after cancer.
TITSOCTOBER, a breast cancer awareness campaign powered by PHARMEDIA.